I was in the process of building this home that I'm sitting in, and I noticed in my left breast that I had an indentation. I hadn't told my best friend. I hadn't told her because I knew if I told her, that would be it. I think at that point, that was when it hit me. And before I had the radiation done, they did another bone scan. And it was at that point they discovered that I had stage 4, that it was in the T4 of my back. They said that they had a doctor who was doing a clinical study, which is Dr. Palma. I remember one particular time when he showed me on his computer the scan, and it was growing. The bone was actually growing back, and it was healthy bone. And I mean, to think that your body can do that and that you can get rid of something like that, and it is stable to this day.
It was just a lot of fatigue and not being able to get out of bed. I just couldn't function.
Dr. Skeens comes to see me and says, we've run into a few problems. I needed to call whoever I needed and have them come to the hospital ASAP to say goodbye.
It was like a slow coming to. It wasn't just like, you watch on TV and somebody opens their eyes and they know what's going on. But the ICU nurses were amazing. I said, let's just do this. Let's just put me on the list and let's get, a new heart.
We were originally told that it might take us up to a year to conceive, and so it only took us 6 months, which was great. Around 24 weeks is when things started to really go wrong with that pregnancy. I was considered to be in critical condition, and that's when it really started hitting home for me that I don't think that we're bringing home a baby with us anymore.
We were told by Dr. Grattan after the first time that you're automatically high risk, and he'd happily take the case.
The doctors had said, you live 2 hours away, you have this history of very difficult loss, and we are expecting some additional complications at any time. If you get to 30 weeks and things are still going well, Killam Apartments has donated a unit, and we think you'd be a really good candidate to be able to go and stay there. Coming to the apartment for the first time, it just felt like coming home. Suddenly you just kind of had this calm, peace environment where it felt like I can just be myself. I can just be a normal person.
I am the living proof that, when you give money and you give it to research, that research can then be put forward to other people and people who are in dire need of help.
In order to keep moving forward with technology and with research, we need money. People drive miracles. I would not be here today if donors like you did not help.
So this is our son, Charles. He's almost 6 months old now. And, when we think about all of the people that made, him possible, that all of the donors and the staff, it's really overwhelming that we were able to bring him home, and we're so grateful to them. I mean, they made our family possible.